Juvenile idiopathic arthritis. Juvenile idiopathic arthritis, formerly known as juvenile rheumatoid arthritis. It is most common type of arthritis in children under the age of 16. Juvenile arthritis can cause severe joint pain, swelling, and stiffness, and some children may experience symptoms for few months, and some can experience up to several years. And further symptoms are like pain, swelling, stiffness in the joint area, mobility problem, eye inflammation can also be there, joint damage or crepitations can be seen. Now, what are the causes? Causes behind the juvenile arthritis is when our body's immune system attacks its own cells and tissue, so then this condition happens. Risk factors: girls are mostly have susceptibility of developing juvenile idiopathic arthritis. Complications are eye problems like cataracts, glaucoma, and even blindness can occur. Growth problems can also be present, which hamper the growth of a child. Moving on to the investigation part. Investigation is done by clinically by asking the proper history of the disease and by examination after the X-ray examination of the knee joint or various joint. We can confirm the diagnosis. Moving on to the management part. Management include, first of all, we will give the NSAIDs to the patient for the pain, swelling, and inflammation of the joint. When there is no response by the NSAIDs, then we will shift on to the DMRDs, disease modifying reagents, in which two classes we use, biological and non-biological. In biological we use the methotrexate. If response achieved by methotrexate, then continue the same treatment. If not achieved by NSAIDs or biological, then we move on to non-biological DMRDs like leflunomide. And if response achieved, then continue the same treatment and observe the patient at various intervals. And if still no improvement is achieved, then combination treatment is opted by using NSAIDs and biological DMRDs, which are methotrexate, and corticosteroid injections into the joint can also be recommended as an additional therapy, which are triamcinolone. Hexacetonide is strongly recommended as the injection in the intra-articular region. At last, we do physical and occupational therapy for the rehabilitation to limit the functional limitations, and also for child effectiveness in the locomotory activities and his day-to-day activities. Thank you.